Do you want me to introduce myself?
Sure.
My name's Liz Quayle. I'm a 46-year-old female, and I am very excited to talk about my experience coming to NUCCA Chiropractic with Dr. Justin Brown. For 20 years, I have suffered with numerous ailments, and I have been all sorts of places across the country trying to get help and relief for my symptomology. About 18 years ago, I was diagnosed with atrial fibrillation. I have had 2 ablation procedures on my heart, and those ablation procedures were successful and have left me with a very slow heart rate, which brings its own side effects along with it. And so I've struggled with heart arrhythmia for almost 20 years. And in addition to that, about 5 years ago, I was also diagnosed with postural orthostatic tachycardia syndrome, also known as POTS, which is an ailment that kind of gives me a racing heart, dizziness, night sweats. I wake up in the night a lot and don't feel well. I feel like my throat's going to close up, and a lot of gastrointestinal issues also come up. So I am very intolerant to a lot of pharmaceuticals, a lot of drugs I don't process well. So throughout my time in the last 20 years, most of my care has come through the Mayo Clinic, both in Jacksonville, Florida and at Rochester. And it was through a recent visit to the Mayo Clinic in Jacksonville that I got to Dr. Brown. I had been through a week-long battery of tests there, and my physician there, Dr. Mark Moon, at the end of the consultation that we were having, suggested that I might go look up somebody that I was very lucky to be close enough to drive to, Dr. Justin Brown. And Dr. Moon had suggested this to me because he said that he had found a lot of relief for some things that he had been dealing with, and his wife and his daughter also had gone to get NUCCA care, and he thought that it may be, the word he used was transformational in my life. And so anything that the Mayo Clinic has told me to do, I try and do very quickly, as I'm looking to get my health back as quickly as possible. So I came to see Dr. Brown, and I had a very thorough examination, and when I came back to get the results of that, he informed me that I did in fact have a subluxation issue, and thought that I could benefit from having treatment. So I began treatment, and the first adjustment that I had was very interesting because I was coming looking for relief of my issues for my POTS and my heart arrhythmia issues. But what I had forgotten was that I also had had an eye drop put in my eye in August of last year that blew out the right facial nerve in my face. And I had gone to see neurologists who had told me, whatever feeling you have in your face after 6 months, it will never return. You just need to, you know, put that aside and realize that as long as you can live with that facial nerve being out, there's nothing we can do except for surgery. So I had given up hope of ever feeling the right side of my face, and the facial nerve issue went all the way into my tongue, down my throat, to the back of my ear, and up my head. And I had lived with it so long that I just wasn't even thinking about it anymore. I was more concerned with my heart and my POTS issues. And at my first adjustment, within 5 minutes, I had a huge feeling of something going on the right side of my face. And I said to my daughter, something feels odd, and she said, does it hurt? And I said, no, but it feels like something is happening on my face. And then I kept touching it, and I said, oh my gosh, I can feel my face. It was miraculous is the only word that I can use to describe it, and you know, it brings tears to my eyes to think about it, but I can feel my face today for the first time. For the last 6 weeks, I have felt my face. I can feel the back of my tongue. That part is miraculous. And also, a lot of my stomach issues have calmed down. I have only had 2 episodes really up at night with the POTS and the heart going crazy, and for me, over 6 weeks, only 2 episodes is a huge improvement in that short of a time. So I am a huge believer, and I will be a Dr. Brown patient for as long as he's in business.